Determinants of Health, a framework for reaching Healthy People 2020 goals. What makes some people healthy and others unhealthy? How can we create a society in which everyone has a chance to live long, healthy lives? These are just a couple of the important questions that Healthy People 2020 explores. The range of personal, social, economic, and environmental factors that influence health status are known as determinants of health. Determinants of health include biological and genetic makeup, individual behavior, social interactions and norms, the physical environment, and access to health services. For example, stress, discrimination, education, housing, and unemployment are all determinants of health. Healthy People 2020 places new emphasis on the social determinants of health while continuing to address the full range of determinants. Health starts in our homes, schools, and communities. Meet Carla, a 6-year-old African-American girl. Carla lives in an urban area. She doesn't have any parks or playgrounds close to her apartment building, so she does not get enough daily physical activity. Carla takes the bus to school and back. Carla's grandmother stays with her after school. Carla typically watches 4 hours of TV a day. Carla's apartment building is old and in need of repair, exposing her to mold and lead dust. Now, picture an intervention that can change Carla's determinants of health. The school board and the local health department work together to keep the gym at Carla's school open later on weekdays and on days when the school is closed for vacation. This provides community members with a safe space to exercise and play for free. Now, Carla's grandmother meets her at the gym after school. Carla's physical activity level increases as she spends more time playing with friends at the gym and walking around the track with her grandmother. She is spending her after-school hours at the gym, which means she's watching less TV and has less exposure to mold and lead dust. Let's look at another example. Meet James, a 76-year-old Caucasian man. James can no longer drive and relies on public transportation to get around. He lives in a low-income neighborhood surrounded by convenience stores and fast food restaurants. James has to take the bus to get to the closest grocery store. Diabetes runs in his family, and James was recently diagnosed with type 2 diabetes. What type of intervention may benefit James? How about a subsidized farmers market within walking distance to James' apartment? The City Health Department and a statewide farmers organization create a local farmers market program in James' community. The program is subsidized by the city, which allows farmers to sell fruits and vegetables at a lower cost. The farmers market program targets high-density, low-income neighborhoods like James. Now, James walks to the farmers market each week, increasing his physical activity level. He's eating more fruits and vegetables now that he can afford them. James is also eating less canned food high in sodium. James' new diet and increased physical activity are helping to keep his blood sugar under control. Public health interventions typically target one or more determinants of health through information, policies, and programs. Each intervention is designed to produce a specific health outcome or outcomes. Outcomes could include positive behavior change, reduction in diseases, conditions, and their risk factors, fewer injuries, improved well-being and health-related quality of life, and increased health equity and reduced health disparities. This is at the core of the Healthy People 2020 framework. Every intervention has a life cycle of its own, a continual process of improvement made up of 4 phases: assessment, monitoring, evaluation, and dissemination. Through this cycle, an intervention can be refined for greater effectiveness. Healthy People 2020 places renewed emphasis on determinants of health, health equity, and healthy development throughout all stages of life. By addressing determinants of health and promoting health equity and healthy development across the lifespan, Healthy People 2020 provides a framework for a society in which all people can be healthy, both now and for generations to come. For more information, go to www.healthypeople.gov.
You are here today because you made a decision to be a nurse. CUSIN, you may ask? CUSIN is composed of 6 competencies, which together form a goal to educate future nurses on ways to enhance quality of care and safety within the healthcare system. Each competency includes proposed targets that are encompassed within 3 categories of care. These 3 categories of knowledge, skills, and attitudes. What exactly are these competencies? Let's take a peek into the life of a nurse and experience examples firsthand.
This isn't my patient, but on this unit we help each other out and use teamwork. I'm gonna go check it out. Hi, I saw your call light on. You look a little uncomfortable. You need some help?
I'm just a little uncomfortable. Do you think you could help me move up a little bit?
Sure can. Let's go get some help. Hey, can I get some help moving my patient up?
Sure.
Thanks.
Okay, so give yourself a hug and lift your head. Here we go. 1, 2, 3. Up, sweet daisies.
Alright, so your patient, Mrs. Johnson, 403, she has a history of falls. So what we're going to do, we're going to implement our fall protocol. Evidence and all the studies have shown that this protocol is working to decrease the amount of falls in the facility.
Okay, sounds good. All right, Miss Johnson, I want you to call, don't fall.
Morning, everyone. How are you? Good. Okay, so here are your shift assignments for today. And I just want to start off by letting you know that corporate came and told us that they were very proud of us because we implemented our safety protocol for falls. And we actually got our numbers down quite a bit. So yes, we are down to 2 on the unit for the past 2 months, so that's awesome. Great job. Let's try and hit 0.
Yeah, okay. I've been making sure everybody had their yellow socks on and their tags on.
Good, good. Yes, let's keep that up for sure, okay? Also, the flu shot is going to be available in HR, but only on this day, on the 10th, okay? So make sure you get there to get that at 8 a.m. or 8 p.m. And we really want to do that just to make sure that we decrease the incidence of flu going around the hospital, whether it be amongst the staff or amongst the patients.
Soft shoes. Whenever you plan your care, it's their views they should share, and you recognize the patient's values. Then you respect their beliefs, and don't give them no grief, and the care is centered around the patient. And by pointing out the needs of your patients, they will love to see you assigned as their nurse. Won't worry about a thing valued like a gold ring, 'cause there's just one thing you gotta do. When you plan for patient-centered care, well, the worries just faded away. When you plan for patient-centered care, the satisfaction is here to stay. You respect their beliefs and don't give them no grief. You plan the care around the patient today. 'Cause when you plan for patient-centered care, well, the worries are faded away.
I'm just an 85-year-old lady waiting to be discharged today, but somebody left my tray table out of reach, but it's okay. Someone left this side rail down for me, so I got it.
Sure, all the safety measures were available, but it's up to the nurses and individuals like you to make sure that they're implemented and our patients stay safe.
You are entering the nursing profession during a time of advancing technology. You will be introduced to safer practices such as scanning wristbands before administering medications, electronically viewing the medication charts, and documenting patient information via computer charting systems. You will have the skills to respond to safety alarms and alerts, use information to monitor outcomes, and coordinate care from different providers such as physical therapy, pharmacy, doctors, and respiratory therapists. You will learn to value technology, appreciate the necessity for continuous learning of these skills, and enjoy demonstrating them when providing patient care. Informatics allows the use of information to manage knowledge, limit error, increase communication, and support decision-making in the nursing profession. Let's review the 6 CUSIN competencies one more time, just to make sure they are ingrained within your brain. Patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics.
Hey everyone, today we are going to talk about one of the ultimate things you need to know for nursing school and as a future nurse, and that is ADPI, the nursing process. It is so important that you understand this, and it'll make your whole life so much easier once you do. A lot of nursing test questions are based on the nursing process, so let's just break it down. The acronym ADPI stands for Assessment, Diagnosis, Planning, Implementation, and Evaluation. And the funny thing about ADPI is that we actually use it in everyday situations without even realizing it. For example, let's say I'm running late to class because I'm brewing a nice hot cup of coffee. I throw it into a thermos and then throw it into my bag and book it to school. Once I get to school, I open my bag and grab my computer and take it out, but it won't turn on. What do I do next? Well, first I'm going to assess the situation. Why isn't my computer turning on? And wait, why is it all wet and everything smells like coffee? Next, I diagnose. Well, it seems to me from all the evidence here that my coffee must have leaked onto my computer and that's why it won't turn on. Next, I need to make a quick plan. What am I going to do to fix the problem? Well, I think I probably need to run to the computer store to get a professional to help me. Then we have the implementation phase, and this is the action part of the plan. This is where I actually bolt to the computer store fast to get it fixed. Evaluation is the final step. Did I meet my desired goal? This is where they tell me, Marley, it was almost a lost cause, but we fixed your computer and everything works great. Don't ever do this again. Okay, so let's turn it back to nursing and apply the exact same steps. When you first go in to see your patient, the first thing you're going to do is assess. This is where you take in all the data, subjective and objective. You're going to look and see what your first impression is. How's your patient looking? How are their vitals? Are they groaning in pain? Do they look pale? Are they breathing heavily? And remember, and this is really key, that assessments are always done first. You're never going to implement an intervention without doing an assessment first. And that's something to burn into your brain for the test questions when they ask about priorities. Because you wouldn't run to the computer store the first moment your computer didn't turn on without doing some detective work, right? The same thing goes for not giving your patient medication before assessing what's really going on. So moving on, the next step is diagnosis. And that's based on our clinical assessment where we identify actual or potential health risks. And the nursing diagnosis is developed by NANDA and should be based on Maslow's hierarchy of needs. But that's a whole different topic and we'll do a whole separate video on that. After that, we make a plan based on the assessment and diagnosis. And this is where you would set a SMART goal. And the acronym SMART stands for Specific, Measurable, Attainable, Realistic, and Timely short and long-term goals for the patient. Then we implement the plan. This is the action portion of the process. This is where we actually intervene to help the patient, like giving them drugs or educating them or monitoring them and so on. And finally, we evaluate. Were we successful in meeting the desired outcome? Did the plan work or is it in the process of working? If not, we need to reassess and start the whole process over, noting why the old goals weren't met and making changes to the new plan of care to make sure that the new goals will be completed. Remember, you have to get ADPI, the nursing process, drilled into your head as a fundamental concept in order to build your critical thinking skills and not only pass your exams, but become a great nurse.
You know that a 3-part NANDA nursing diagnostic statement that is typically taught in nursing education to establish a care priority on a care plan is not the way a nurse thinks in clinical practice. Instead, nurses use the skill of clinical reasoning. Clinical reasoning has 5 essential components. Number 1, Think in action and reason as a situation changes. Number 2, capture and understand the significance of clinical trends and trajectories. Number 3, filter and recognize what clinical data is relevant and why. 4, grasp the essence of the current situation. And 5, identify if a problem is present. This is the end result where a clinical judgment must be made. As a nurse educator, when I taught fundamentals, I quickly recognized that students required every task to be broken down step by step in order for it to be understood and incorporated into their practice. Even a basic skill such as hand washing had 5 to 10 steps. I had no idea it was so complicated because I do it intuitively as an experienced nurse. In the same way, clinical reasoning needs to be broken down step by step so students can apply it, understand it, and incorporate it into their clinical practice. Today, I will share 8 essential sequential steps that a nurse uses to clinically reason and identify the care priorities in the clinical setting. These essential steps are part of what you reflect and ask as you are acquiring data before you see the patient for the first time. Step number 1, what is the primary problem and what is the physiology of this problem? You as the nurse must not just memorize physiology, you must deeply understand why your patient has the problem they do. This is essential to develop the critical thinking that is required for practice. Number 2, what clinical data did you collect is relevant and must be recognized by the nurse? This is why I addressed in prior YouTubes, do you know your BMPs or your CBCs? Which labs do you focus on as the nurse so you can recognize relevance and clinically reason? Step number 3, what nursing priority captures the essence of your patient's problem and will guide your plan of care? There are times where NANDA nursing diagnostic statements will fit, such as impaired gas exchange or fluid volume deficit, but students must not be forced to make a NANDA statement fit like a square peg in a round hole where it doesn't belong. Therefore, NANDA can be a no-no, and students must be allowed to simply state the primary problem as a nursing priority without NANDA taxonomy at times. Number 4, what nursing interventions will you implement as a result of this identified nursing priority? As you can see, nursing process is integrated in this step-by-step approach by identifying the nursing priority and then the interventions that will follow. Step number 5, what body system will you as the nurse focus on because of the patient's primary problem? Though you are trained to do a head-to-toe assessment, you as a student must focus on what is the primary body system that's impacted by the primary problem. So for example, if a patient has pneumonia or a COPD exacerbation, you are going to spend much more time focusing on the respiratory component of your head to toe versus the GI. Listening carefully to anterior versus posterior breath sounds is an example of what you will do as part of your nursing assessment. Step number 6. What is the most likely or worst possible complication that the nurse must anticipate based on the primary problem that the patient presented with? Never let your students forget that Jason is still out there. If you are a fan of Friday the 13th, you know that Jason was a killer, and killers such as sepsis are still endemic within clinical care. If you remember the ending of the first Friday the 13th, everything was calm. Alice survived the night. The police were there. The lights were on. The sunrise was present. But out of nowhere, Jason came out of the water and took her down. But it was only a dream. But in clinical practice, Jason is still out there, and he wants to take down your patient. Therefore, you as the nurse must be looking for him and not let him take your patient down. Step number 7. What nursing assessments will you be utilizing to identify and recognize Jason as a complication if he presents himself? For example, sepsis is the most common complication that patients experience postoperatively. The nurse must recognize that elevated heart rate, over 90 to 100 without a good reason, is a clinical red flag of compensatory changes related to cardiac output. Your patient's sliding. You as the nurse must recognize it. And step number 8, what interventions will you as the nurse implement if Jason decides to show his face in your clinical setting? For example, if you identified sepsis as the most expected complication, you know what to assess for. Now what will the nurse do if Jason shows up? Who are you going to call? It better not be Ghostbusters. Therefore, be ready and be proactive, not reactive as a nurse in practice. There are an additional 4 questions that the nurse must reflect on and ask when they see the patient for the first time. I will talk about that in my book, Think Like a Nurse. If you would like more on these essential questions to develop your ability to clinically reason and think more like a nurse, look no further than Chapter 9 of my student textbook, Why Clinical Reasoning is Nurse Thinking, in Think Like a Nurse, Practical Preparation for Professional Practice. Never forget that if a nurse fails to recognize a change of status such as sepsis before it is too late, a patient can die as a result. Therefore, to think or not to think like a nurse can literally be a matter of life and death. If you like this video, please share it, or better yet, subscribe to my YouTube channel, Think Like a Nurse. Also be sure to click the link to my book, Think Like a Nurse, in the video description on this tube.
You ready to go to dialysis now?
Yeah, I think so.
I think it's going to be a really good experience. I just want you to keep those things in mind as you go out and then try on this observation.
Okay.
Hey, what's up?
Excuse me, I just wanted to get your attention for a minute because my patient I've been caring for, I just noticed in the last 4 hours they've had a low urine output of like 40 mils, or like 30 mils for the whole period. So I just want to get in touch with my nurse.
Okay. Yeah, let's do that. Let me just finish with Megan. She's going off to dialysis, and just give me 1 second.
Okay.
All right. So anyway, I hope you have a good time.
Okay.
All right. Bye. Okay, Rob. So tell me more about your patient.
Well, they are 1 day post-op for cholecystectomy.
Oh, okay.
A 42-year-old male.
Okay.
Now, all morning, vital signs have been pretty stable. Heart rate and blood pressure were okay. He's on 100 mils an hour, normal saline, fluids, and the labs, though, that just came back, although the creatinine was okay, the BUM was a little high, it was 40.
Oh, okay.
So...
and his urine output has been 30 mLs in the last 4 hours. Okay, so that's significant. That's a big change. Well, you know, one of the ways we're going to communicate this to your nurse is in what we call SBAR format.
Okay.
So let's go over that and see if we can really make this information more concise, so when you communicate, you get across what you want to tell them.
Oh,
okay? So SBAR stands for situation, background, assessment, and your recommendations as an RN. And it's a really nice way to communicate with your doctors, NPs, PAs, or even the nurse that we're working with. So in this case, your S is your situation. What would you say the situation is?
Situation is quick description of my patient, a 42-year-old male.
Yep.
And
it could be that the situation is you have a low urine output.
Oh, okay.
So that's it. That's your big finding. So your situation is that thing that said, okay, I need to communicate this.
Okay.
So we'll go with that, is the low urine output. Your background is what you're talking about.
Oh.
Patient is a
42-year-old male.
Right, and he just had...
He's 1 day post-op.
Exactly. So that's the background of what's going on. So then you also gave me a further assessment. You talked to me about the labs.
Right.
So we're going to conclude that your assessment includes the labs, that the vital signs have been stable, okay? And you could also note, because maybe he's holding on to fluid, so you might want to note, does he have edema too going on? his lung sounds a bit clear, because he's getting IV fluids at 100 mLs an hour, and he's been getting that for the last 24 hours, plus he got fluids in surgery. So there's fluids on board, he's not urinating them out. So he's might be third spacing, may or may not. So we want to definitely look at that. And then your recommendations. I thought you were spot on. You had a feeling maybe we should do some diuretics. Many times patients need a diuretic. So I think that's a great thing. So do you see how this format would really help you communicate?
Yeah, it would make it look a lot clearer and quicker. I
Yeah.
need to bring someone else into the picture for us.
So let's do that.
Okay, great. Hey, Deb.
Hi, Rob. How are you this morning?
I'm doing pretty well. If you're all done with meds, I'd like to interrupt you for a second.
Yeah, I've got a minute.
Okay, great. So I have something that I wanted to bring to your attention. It's about Mr. Beans over in 41. I brought it to the attention of my clinical instructor. Now, what I want to do is deliver you the information in SBAR format, since that's what we just went over.
Okay.
So the situation is I have a low urine output. The background is a 42-year-old male in room 45. He's 1 day post-op from cholecystectomy.
Okay.
Now the assessment findings have been regular heart rate, regular blood pressure, and lab values came back. BUN's a little high, creatinine's okay. As far as third spacing and edema, no signs, and lungs are clear bilaterally. So my recommendations are going to include maybe a Lasix or a diuretic into his medication regimen right now, so he can maybe increase his voiding output.
Okay, I think it's a very good assessment and a good idea. We'll give the physician a call.
Okay, great.
Okay,
Sounds good.
Okay.
Thank you.
You're welcome.
In order to delegate effectively as a registered nurse, you need to make sure you assign the right task to the right person under the right circumstances. You also need to be sure to provide the right direction, communication, supervision, and evaluation throughout the process of delegation. The Joint Statement on Delegation from the American Nurses Association and the NCSBN states that nurses need to use critical thinking and professional judgment when delegating a task to ensure that these 5 rights of delegation are followed. In this video, I will explain the 5 rights of delegation. Understanding these rights will help you delegate appropriately in real life and on the NCLEX. Throughout this video, I will give you some tips to help you remember what to delegate so you can pass the NCLEX. The right task. Before delegating a task, you need to be sure that it is the right task to be delegated. In order to delegate a task, it needs to be within your scope of practice. It also needs to be within the caregiver's scope of practice and job description. Organizational policies and standards, laws and practice guidelines in your jurisdiction, professional standards and codes of ethics should all be taken into consideration when tasks that can be delegated are identified. When you delegate a task, the task needs to be for a specific client at a specific time to promote desired outcomes for that client. Client needs need to be met when the delegation occurs. RNs should never delegate the nursing process. I explained the roles of members of the healthcare team in another video, but in short, remember that you cannot share your teacup. I have doubled the A in this acronym, but it still works because you really don't want to share your teacup. T stands for teaching. RNs need to do the primary teaching because it is such an important part of health promotion and disease prevention. E stands for evaluation. Others can collect data for you, but the RN needs to interpret it, formulate the nursing diagnoses, and judge client progress towards meeting goals in the care plan. A stands for assessments. Assessments need to be done by the RN. LPNs can do routine assessments, but RNs need to complete initial assessments on new patients, regular follow-up assessments, or assess when there is an emergency or a change in patient condition. The second A stands for advanced interventions. That is things like administering IV medications where specialized knowledge or skill is required. C stands for collaboration. RNs need to be the ones to work with physicians or others on the healthcare team to resolve client issues. U stands for unstable patients. RNs need to be the ones to care for unstable patients. Never delegate care of an unstable patient to an LPN or UAP. P stands for planning. RNs need to be the ones to identify client goals and develop care plans. The right circumstances. Delegation must occur under the right circumstances. Client needs must be assessed. A task like positioning a client may be appropriate to delegate to a UAP in many circumstances, but is it right in your current circumstances? It is your job to assess each client's goals and needs. It is also important to consider if safe care can be delivered using the resources available. You need to consider the competency of your assistive personnel and how much supervision is needed for the task. You need to balance the needs of the client with the competency of the care providers available. Be sure that assistive personnel can be appropriately monitored and guided. Do you have the skills and knowledge to safely delegate the task? The right person. It is critical that you are sure that the person you are asking to perform a task is competent to perform that task. You need to assess if they have the knowledge and skill that is needed to perform the task being delegated. Consider any certifications or licenses they may have, as well as training or documented knowledge. Have you seen them demonstrate their competence in performing this task? Have you seen them doing skills? If their competence is not already assessed or documented, you may need to teach them what to do or go with them to assess that they know what they are doing with a specific client or task. You also need to consider how stable your client is and how predictable the outcome is. UAPs and LPNs cannot be assigned to unstable patients. The outcome of the task they are doing needs to be predictable. The right direction and communication. When you delegate, you need to be sure that you have provided clear directions. You must be sure that a specific person was told to help a specific client. The way that delegation decisions are communicated will depend on where you are working. It may be done verbally or in writing. Typically, agencies have set up processes for communicating and dividing client workload. The American Association of Critical Care Nurses Handbook outlines the 4 C's criteria for the right direction. Are your initial directions clear, concise, complete, and correct? You must clearly direct assistive personnel during delegation. The activity that you are asking them to complete must be concisely described. That way you don't confuse anyone. You need to be sure to provide them with complete information about the activity, including what objectives you need met. You also need to communicate the correct limits and expectations for the activity. In certain situations, more specific communication may be needed. For example, if you are working in long-term care and you are monitoring a client's bowel movements more closely than normal, you may need to ask the UAP to report verbally to you if the process normally just involves written documentation. In these situations, you need to let the UAP know that you need to be told within a certain time frame that is different than normal. The assistive personnel should feel comfortable letting you know that they need help or that they don't know how to do something. Feedback should be ongoing and reciprocal. Be open to feedback that can help you improve. Assistive personnel should be involved in the flow of information and recognized for their efforts. A simple thank you can help promote an environment for open communication. When problems arise, get them involved in brainstorming potential solutions. The right supervision and evaluation. Once a task is delegated, your job isn't over. You need to monitor the completion of the task since you are still accountable for ensuring safe client care. An RN or other licensed nurse needs to supervise certain nursing activities. After clear directions and expectations are given, there is a need for ongoing monitoring and feedback. You can give the person you are working with feedback about how they are performing the activity, and they can give you feedback about how you are delegating and communicating. Make sure you respond to questions and help in problem solving as needed. Whenever needed, you should intervene to promote safe client care and learning for the assistive personnel. As long as you approach it in a professional and caring way, people should be open to your feedback. Be sure you document delegation activities using the methods appropriate in your setting. Do not forget to evaluate how things went. Evaluation is an important step in the delegation process. Both the client and how the task or activity was performed should be evaluated. Evaluation enables quality improvement and professional growth for you and the people you are working with. Are staff reporting when the tasks are completed and how the client responded? Are you providing appropriate teaching and guidance? Are issues or problems being reported properly? If you like acronyms, you can use DEPICS to remember the important components of the 5 rights of delegation. Everyone refers to it as 5 rights, but there are more than 5 things to remember. I just changed communication to interpersonal communication so I could fit all these elements into one word. When you follow the 5 rights of delegation, You will be able to delegate properly in real life and on the NCLEX. Thank you for watching.
You may believe your nurses are performing well, but how do you know? You may believe you need improvements in nursing, but what do you improve? You need data to make decisions. ANA's National Center for Nursing Quality houses the only national nursing quality measurement program. It provides hospitals with performance reports for each nursing unit and comparisons to national averages and rankings.
I think the data is necessary because it allows a hospital to see how well are they really doing and allows them to benchmark themselves against other hospitals.
When you're looking at data for quality improvement, you need to be able to drill down and to be able to determine what the root cause is of a particular issue.
The data allows us to have evidence-based practice in our care to our patients.
NDNQI compiles data collected from participating hospitals in areas such as patient falls, pressure ulcers, infection rates, and work environment. Hospitals are honored for top performance based on outcomes.
The impact is it demonstrates to the staff that the work that they're doing through quality improvement does benefit the patients. The award demonstrates to us and to the rest of NDNQI that we've achieved outstanding outcomes.
Winning the NDNQI Award for Nursing Excellence at a community hospital means that our staff are making a difference every day at the bedside, that we're preventing the complications, that we're promoting patient safety.
1,400 of 5,000 hospitals nationally have joined NDNQI to evaluate nursing care and improve patient outcomes and the work environment. Nurses attending the NDNQI conference learned about the latest research and best practices. Julia McCauley wants to improve the work environment by creating a code of ethics poster that staff would sign.
And it holds everybody accountable to treat each other the way you would want to be treated, to make for a pleasant work environment, because those are one of the indicators that we find if it's a healthy work environment that there are better patient outcomes.
My take-home messages include the importance of stressing the value of nursing in this healthcare environment, and also looking at how we can better use the resources that we have. We all are very challenged, I think.
This year I came wanting to learn specifically more about nurse satisfaction, and so far that's happening, and I hope to take all that home and kind of inspire some people at the University of Washington Medical Center to look a little more deeply into nursing satisfaction measures and benchmarks.
NDNQI helps nurses understand, through the help of ANA, helps nurses understand how we can define how great we are. And it's through our own outcomes and our own practice as we can say, yes, I know I'm great.
ANA President Rebecca Patton says 20 years ago she didn't hear much about evidence-based practice. But nursing has matured. Today, decisions made without a scientific foundation could be questioned.
I have to believe that every hospital in this country, every nurse exec that runs a nursing service would want to do what's in the best interest of those patients. You need the data to do that. So why would you not want to access and participate in a database that is one of a kind? There's nothing else in this country like it. I would encourage everybody that's not participating to give it a serious consideration, because the bottom line of their hospital performance, this will enhance it.
Use the PICO format to formulate a clinical question to search for evidence. Evidence-based practice, or EBP, is the integration of best research evidence with clinical expertise and patient values. The 5 steps of EBP are: Step 1. Work out what it is you want to know. Step 2. Identify the key concepts you're searching for. Step 3. Search for the evidence. Step 4. Appraise the evidence. Step 5. Putting evidence into practice. In this video, we'll look at the first 3 steps. Step 1. Working out what it is you want to know by formulating a clinical question. Step 2. Identifying the key concepts by converting your clinical question into a search strategy. And Step 3. Searching for the highest level of evidence that answers your clinical question. PICO is an acronym for Patient, Intervention, Comparison, and Outcome. We use the PICO format to extract the information from a clinical situation to focus on a particular question. P describes the patient, population, or problem of interest. I is the intervention planned. For example, treatment with a particular drug, developing a management strategy, performing a diagnostic test, a treatment regime such as radiotherapy or chemotherapy, or referral to an allied health worker. C is the comparative intervention. Is there an alternative intervention or type of management strategy? There will not always be a comparison. The comparison may be to do nothing or take no action. O is the outcome. What is the desired outcome? What is the effect of the intervention? Our example scenario is: if exercise therapy can reduce pain in patients suffering from degeneration of the knee, maybe we should recommend it for all our patients with osteoarthritis of the knee. C. Usual care. O. Reduce pain. Our clinical question becomes: in adults who suffer from degeneration of the knee, does exercise therapy help with reducing pain? We can now move to Step 2, where we identify the key concepts in our clinical question to formulate our search strategy. What are the key words? Degeneration, knee, exercise therapy. Remember to include synonyms, plurals, and alternative spellings. Consider different terminology used in different areas. Step 3 of EBP is to search for the highest level of evidence. There's a recognized hierarchy of reliability to use as a guide when considering the effectiveness of evidence. For therapy or intervention questions, the ideal source of evidence is a systematic review. Systematic reviews summarize the results from a large number of high-quality research studies. Close behind is a well-done randomized controlled trial. The Cochrane Library is an excellent place to start. If this proves unfruitful for the specific question you need answering, you should then conduct a search of articles published in scientific journals. A number of databases are available to assist you in searching for the literature, for example, PubMed and Embase. If the search for published literature proves unsuccessful, move down the hierarchy of evidence until you find some useful sources. A word of caution here: the lower down the hierarchy you go, the less reliable the evidence is likely to be. Our next videos will demonstrate searching for evidence in traditional and specialized databases, including PubMed, Embase, Sinal, Cochrane, and Pedro.